Imagine trying to see the world, maybe through a frosted window, but you don't quite realize how blurry everything's become.
Mm,
Or think about an animal like a horse, relying so much on its vision for, well, everything. Performance, safety facing something that slowly steals that sight.
yeah, it's a tough situation.
Today we're taking a deep dive into something surprisingly common in horses. Cataracts.
And this deep dive, it's pulling from, expert veterinary research, clinical insights. We're really going to unpack equine cataracts.
Everything, like how they form, diagnosis.
Exactly. How they form, the pretty intensive process for diagnosis and treatment, and really importantly, what the long-term outlook, the prognosis actually looks like.
Okay.
Our mission here is simple. Give you a really clear, comprehensive picture of this condition. It's often misunderstood.
So let's start right there. What is a cataract exactly? We hear cloudy eye all the time, but it's more specific, isn't it?
It really is. A cataract isn't just any cloudiness. It's specifically an opacity or some kind of alteration within the lens itself or its capsule that actually blocks or scatters light trying to get to the retina.
And the lens, its main job is just focusing that light, right, for sharp vision?
Precisely. It needs to be crystal clear to focus light properly onto the retina.
So why should listeners care? I mean, how common is this?
Well, it's more common than you might think. As a primary eye disease, cataracts pop up in maybe 5 to 7% of horses. But get this, when you look at foals born with eye anomalies, congenital ones, something like 33 to 35%, a third, have cataracts.
Wow, that's huge in foals.
It is. And the tricky part is that horses are, well, masters of compensation. They can hide vision loss really well, which makes it subtle, but still a really significant issue for owners, for riders, to even notice.
Okay, let's get into the mechanics then. What's actually going on inside the eye? The lens first describe that for us.
Sure. So the horse's lens, it's this clear structure, biconvex curved on both sides, and avascular, meaning no blood vessels. It sits right behind the iris and the pupil.
And it's clear because?
Because it's made mostly of water, and these highly organized proteins are called crystallins. Their precise arrangement is key to transparency. And here's something really interesting. The lens grows throughout the horse's entire life, continuously. New fibers are always being laid down on the outside, compacting the older fibers towards the center, the nucleus.
Okay, continuous growth. So how does that relate to cataracts forming? That precise arrangement gets messed up somehow.
Exactly. That's the core issue. When a cataract forms, that precise, almost architectural structure of the lens fibers is disrupted. Think of it like a domino effect inside the lens. You get a decrease in those soluble proteins we mentioned, a crucial sodium pump in the lens cells starts to fail, levels of a protective antioxidant called glutathione drop.
Right.
And all that leads to the lens fibers swelling up, eventually rupturing. That disruption, that's the opacity. That's the cataract.
So it's a real breakdown at a microscopic level, not just cloudiness. And speaking of cloudiness, you mentioned it's important to know that not all cloudiness is a cataract, right?
Absolutely. Critical point. There's a really common age-related change called nuclear sclerosis that often gets mistaken for a cataract.
Okay, nuclear sclerosis, when does that happen?
You typically see it in older horses, maybe over 15, certainly over 20 years old. It's just a normal increase in the density of the central part of the lens, the nucleus.
And it looks.
Gives the lens a grayish or sometimes yellowish look. They call that brunescence.
Yeah.
But, and this is the key difference, nuclear sclerosis generally does not impair vision. It's aging, not disease in the same way a cataract is.
That's a really important distinction for owners of older horses. Okay, so knowing that, let's talk about true cataracts. What causes them? How do vets classify them?
Well, they classify them in a few ways. By the cause or etiology, the age the horse develops it, where exactly in the lens it's located, and of course how severe it is.
Got it. And the causes seem pretty varied. Let's start with the ones horses are born with congenital cataracts. Genetics plays a part here.
Oh, definitely. While any horse can get them, some breeds show up more often.
Yeah.
We see higher rates in thoroughbreds, standardbreds, quarter horses, Belgians, Morgans, Rocky Mountain horses, Appaloosas.
So quite a few popular breeds.
Yeah. And these can be inherited in different ways, dominant or recessive. Often they're bilateral, both eyes and symmetrical. And here's a fascinating detail.
Oh.
Morgan horses can have a specific type of congenital cataract. It's non-progressive, right in the nucleus, bilateral, symmetrical, but it usually doesn't seem to bother their vision much at all.
A genetic quirk indeed. What else causes congenital cataracts besides genetics?
Things that happen in utero. So if the mare gets sick during pregnancy, has nutritional issues, or is exposed to certain toxins or even infectious agents like equine herpes virus, that can trigger cataract formation in the developing foal. You can also see them alongside other developmental eye problems. Sometimes you see little remnants of the fetal blood vessels, like persistent pupillary membranes. Those are usually no big deal. But sometimes congenital cataracts are part of a bigger picture, with other defects like microphthalmos, a small eye, or aniridia, where the iris is missing.
Okay, so that covers the congenital side. What about acquired cataracts, the ones that show up later in life?
Right, acquired cataracts. These are actually the ones we see most often in adult horses.
And the number one cause here is?
By far the most significant cause of acquired cataracts in adult horses is equine recurrent uveitis, or ERU. You probably know it as moon blindness.
Ah, moon blindness. Nasty stuff.
It really is. It's this chronic or relapsing inflammation inside the eye, and that inflammation directly damages the lens fibers over time. These ERU-related cataracts, they're often progressive, they get worse, and they usually come with other signs of uveitis too. Makes them really challenging.
Makes sense. Trauma seems like another obvious cause. A direct hit.
Yep, trauma is definitely on the list. Blunt force, a sharp injury to the globe, either can directly damage the lens and start a cataract forming.
Are there other, maybe less common causes for acquired cataracts?
There are. Things like glaucoma, high pressure in the eye can sometimes lead to cataracts. Same with retinal detachment or degeneration.
Mm-hmm.
Less commonly, you might see it with an intraocular tumor.
Okay.
Very rarely. Maybe a metabolic disease like diabetes, though that's uncommon in horses. Severe nutritional issues are unlikely in adults on good diets, but could be a factor. And sometimes medical treatments themselves, like previous eye surgery or radiation, can inadvertently cause a cataract. We call those iatrogenic.
And finally, what about just old age? Senile cataracts.
Right, senile cataracts. We mentioned nuclear sclerosis earlier as an aging change. True senile cataracts are also age-related, again, usually in horses over 15 or 20. They tend to progress quite slowly and often don't cause significant vision problems until they're very advanced.
So we understand the what and the why, but how does an owner actually spot the signs? You said horses are good at hiding it.
They're remarkably good at it, thanks to that wide field of vision they have. It makes detection, especially early on, pretty tricky.
So what subtle clues should people look for?
You're looking for behavioral changes, often subtle ones. Maybe unexplained spooking or shying, even in places they know well. A sudden reluctance to go into dark areas, like a trailer, or even into bright sunlight.
Clumsiness.
Yeah, maybe bumping into things more often. Or performance issues, reluctance to jump, or maybe hitting rails more than usual. But honestly, some horses with cataracts in both eyes can seem to get along just fine in their familiar pasture or stall. It's quite amazing.
But the most direct sign, visually, would be?
The most obvious sign is seeing that cloudiness, that white or gray appearance, right there in the pupil. That's harder to miss, of course.
And you mentioned other possibilities, like trouble seeing at night.
Yes, nocturnal blindness can be more apparent, especially if the cataracts are significant. And if a horse has a cataract only in one eye, you might notice them trying to keep their good eye towards you or towards activity. That can lead to changes in how they hold their head.
But if it's linked to uveitis?
Then you might also see signs of that inflammation squinting, which vets call blepharospasm, or excessive tearing, lacrimation.
Okay. So if an owner suspects something's wrong, what's the next step? Diagnosis sounds crucial.
Absolutely.
Yeah.
Getting a clear diagnosis isn't always straightforward. It really requires a thorough ophthalmic exam by a veterinarian and ideally someone with specialized eye equipment.
Makes sense. What does that thorough exam involve?
It always starts with a detailed history. The vet needs to know everything. When did you first notice signs? How quickly have they progressed? Any history of injury? Any previous eye problems, especially that uveitis? Breed matters too, as we discussed, and all those behavioral changes you've noticed.
Okay. History first.
Yeah.
Got it.
Then, a really crucial step, dilating the pupil. Pharmacological mydriasis, usually using topical atropine drops.
Why is dilation so important?
It's like opening the curtains wide. It allows the vet to see the entire lens, edge to edge, not just the small part visible through an undilated pupil. You can miss smaller or peripheral cataracts otherwise.
Good point. Any precautions with atropine?
Yes, it takes a while to work, maybe 30 to 60 minutes. And importantly, atropine can slow down the gut, so horses getting it need to be monitored for any signs of colic. It's a small risk, but something owners should be aware of.
Good heads up. What other tools does the vet use?
The slit lamp biomicroscope is indispensable. It's a specialized microscope that gives a highly magnified 3D view of the front of the eye.
And that showed.
It lets the vet see the precise location of the opacity within the lens, its shape, its density. It's also essential for evaluating other structures, like the cornea and iris, and looking for those subtle signs of uveitis.
Okay. And they look at the back of the eye, too.
Yes, a fundic exam is important. That means looking through the lens to assess the retina and the optic nerve. We need to know if there's any disease back there that could affect the horse's vision, regardless of the cataract. Though if the cataract is really dense, seeing the fundus can be difficult or even impossible.
Right. So if the exam points to a cataract and maybe surgery is being considered, are there more tests needed?
Definitely. For surgical candidates, especially when you can't see the retina because the cataract is so dense, we need ancillary diagnostics.
Like what?
Ocular ultrasound, or B-scan, is critical.
Yeah.
Ultrasound waves can pass through the cloudy lens and give us an image of the structures behind it.
What are you looking for with the ultrasound?
We're checking for things like retinal detachment, major vitreous degeneration, or even intraocular masses or tumors. Basically, is the retina in place and structurally okay? Because if it's detached, surgery won't restore vision.
Makes sense. Structure, okay. What about function?
Exactly. That's where electroretinography, or ERG, comes in. This test measures the electrical response of the retina to light stimuli.
So it tells you if the retina is actually working.
Precisely. It confirms if the retina is functionally intact. If the ERG is flat or abnormal, it means the retina isn't working properly, and again, removing the cataract won't help the horse see. It's a crucial go-no-go test for surgery.
Wow. Ultrasound for structure, ERG for function. Anything else?
Just standard preoperative blood work, CBC, chemistry panel, maybe fibrinogen levels just to make sure the horse is healthy enough overall for general anesthesia and surgery. Rule out any underlying systemic issues.
That's a really thorough workup before even thinking about surgery. Okay, let's talk treatment. If a horse has a cataract, what are the options for restoring vision?
Well, here's the hard truth. For an established cataract, one that's already formed and cloudy, medical treatments are ineffective. Eye drops, medications, they won't clear it up.
So no magic drops then?
Unfortunately, no. Surgical removal is the only method we currently have to actually restore vision by getting rid of that opaque lens.
Okay, surgery it is. What does that involve? And importantly, who's a good candidate? Not every horse with a cataract gets surgery, right?
Absolutely not. Patient selection is incredibly important for having any chance of success.
So who makes the cut?
The ideal candidates are often foals with congenital cataracts, especially if you can operate when they're young, ideally less than 6 months old. That helps their visual pathways develop properly. Temperament is also huge. The horse needs to be manageable for the very intensive post-op care.
We'll definitely come back to that post-op care. What else?
Critically, the horse needs to have no active eye inflammation, especially uveitis, or have it extremely well controlled. And, as we discussed, they need that functionally intact retina confirmed by ERG and ultrasound. Plus, good general health for anesthesia. Any active inflammation is usually a reason to postpone or cancel surgery.
Okay, good candidate identified. What's the surgery itself like? What's the standard technique?
The gold standard today is a technique called phacoemulsification.
Phacoemulsification, how does that work?
The surgeon makes a very small incision in the cornea. Then a tiny ultrasonic probe is inserted. This probe vibrates at high frequency, breaking up or emulsifying the cloudy lens material.
And then?
Those emulsified fragments are aspirated, basically vacuumed, out of the eye through the same small incision.
Okay. Now, in humans, they usually put in an artificial lens, an IOL. Do horses get those?
That's a common question. And the answer is usually not. Intraocular lens implantation is done much less frequently in horses compared to people or even dogs.
Why is that?
Several reasons. The horse's eye is very large, and we don't have a wide range of standardized IOLs specifically designed and proven for them. But the biggest hurdle is inflammation. Horses tend to have a much more robust inflammatory response inside the eye after surgery compared to humans, which can cause complications with an implant.
So if they don't get a lens implant, what does that mean for their vision afterwards? They're left without a lens.
Exactly. They are left aphakic, meaning without a lens. This makes them significantly hyperopic or farsighted. Think of it like needing very strong reading glasses, but for distance. One study suggested they're about +10 diopters hyperopic.
How well do they see being that farsighted?
They lose the ability to focus, especially on close objects. But for general navigation, seeing larger objects at a distance, many horses adapt surprisingly well. They might not be threading needles, but they can often function quite well in their environment. especially a familiar one.
Okay, now let's tackle that post-operative care. You've emphasized how intensive it is. Paint a picture for us.
It is, without a doubt, the most demanding part, and where owner commitment is absolutely non-negotiable for success. We're talking about frequent topical medications, eye drops, or ointments.
How frequent?
Initially, every 2 to 4 hours, around the clock. Antibiotics, potent corticosteroids to fight that intense inflammation, atropine to keep the pupil dilated. Sometimes these are given through a subpalpebral lavage system, a little tube placed under the eyelid to make it slightly easier, but it's still constant.
Wow, every 4 hours, 247. That's a lot. For how long?
That intense frequency might be for the first few days to a week, but the medications, often tapering slowly, can continue for weeks, even months, depending on how the eye responds. It's a marathon, not a sprint.
What else besides eye drops?
There are usually systemic medications too, anti-inflammatories like NSAIDs, maybe oral steroids in some cases, sometimes systemic antibiotics. Strict stall rest is crucial to prevent injury. And eye protection, like a protective cup or mask, is essential to stop the horse from rubbing or bumping the eye.
And follow-up vet visits.
Oh yes, numerous recheck examinations are needed to monitor for complications and adjust medications. It's a huge time commitment, and as you can imagine, it also represents a very significant financial commitment. Cataract surgery and the aftercare are expensive. There's no way around that.
Okay, that intensive care really underscores the challenge. So after all that, what's the bottom line? What's the long-term prognosis? How successful is this really?
That's the million-dollar question, isn't it? And the honest answer is, the prognosis is highly variable. It really depends on so many factors.
Like the original cause of the cataract.
Exactly. The etiology is huge. As we said, foals with simple congenital cataracts operated on young tend to have the best chance for long-term vision. But cataracts caused by ERU, that's a much tougher scenario because you're fighting that underlying chronic inflammation. The risk of complications is way higher.
And owner compliance with that post-op care we just talked about.
Absolutely critical. You can have the most technically perfect surgery, but if the post-op meds aren't given correctly and consistently, the eye will get inflamed and the outcome will likely be poor. It really hinges on that dedication.
Well, what about the horse's age or other eye problems?
Age plays a role. Foals generally do better surgically.
Yeah.
And any pre-existing significant disease, especially active uveitis, glaucoma, or retinal detachment, drastically worsens the prognosis for vision.
So when you look at the studies, the actual numbers, what percentage of horses maintain vision long-term after surgery?
Well, most horses are visual right after a successful surgery. But maintaining that vision long-term, the numbers are more modest than people might expect. One large study looked back at cases.
Yes.
It found that across all types of cataracts, only about 26.3% of horses were still visual and able to continue their normal activity more than 2 years after surgery.
Only about a quarter.
Wow.
That's sobering. Was it different for foals?
Interestingly, in that same study, the success rate for foals maintaining vision past 2 years was even lower, around 9.3%. It really highlights that achieving long-term, complication-free vision is a significant challenge in horses.
That 26% figure is definitely lower than I would have guessed. What are the biggest hurdles? What complications most often lead to failure?
The biggest one, the most common and significant complication, is that persistent uveitis. The inflammation just keeps simmering or flares up badly.
And that leads to?
That inflammation can cause chronic pain, secondary glaucoma, high pressure, and it's a major risk factor for retinal detachment, which is often a blinding complication. Glaucoma itself is another major issue.
Any others?
Other potential problems include corneal issues like ulcers or edema, clouding of the remaining lens capsule behind where the lens was, that's called posterior capsular opacification, or PCO. And rarely, but devastatingly, you can get a severe infection inside the eye, and ophthalmitis.
Given those challenges, is there anything on the prevention side?
Well, for the hereditary forms, the main advice is simply to avoid breeding horses known to have heritable cataracts. That's the best way to try and reduce the incidence in future generations.
This has been incredibly informative, a real deep dive into a complex issue. We've gone from, the tiny proteins in the lens all the way to that marathon of post-operative care.
It's definitely a journey.
And I think what comes through is that while equine cataracts are a major challenge, really understanding the causes, the diagnostics, the sheer intensity of the aftercare is key to giving these amazing animals the best possible shot.
It truly is. It highlights both the advances in veterinary ophthalmology and the incredible dedication required from owners who undertake this.
It really does. And it leaves me with a final thought, something for you, the listener, to maybe mull over. Given how horses see the world, that incredible wide field of vision, and the fact that most are left farsighted after surgery without that focusing lens,
Hmm.
what does seeing really mean for them then? How does their whole perception of their world change, even if we call them functionally visual after treatment?
That's a fascinating question, isn't it?
Yeah.
Certainly a different way of experiencing the world visually. Something to think about.